Welcome to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. With me today is Dr. Ross Goldberg. Dr. Goldberg is the Vice Chair in the Department of Surgery and Associate Professor at Valleywise, Creighton University School of Medicine in Phoenix, Arizona, and heavily involved for many years with advocacy on behalf of all of us and our patients. Welcome, Dr. Goldberg.
Thanks for having me. It's a pleasure to be here.
Well, it's great to have you. And I guess I first crossed paths with you when you were the RAS representative to the PAC, to the ACS PAC. And I've been very impressed with the work that you've done up until now, being the Advocacy Pillar Lead for the Board of Governors. You've done a tremendous amount of work with advocacy. So I thought I'd like to have you share with us some of your reflections on advocacy in the college and some of the things all of us should be doing other than just attending the Leadership and Advocacy Summit.
Sure, absolutely. So anyone who knows me knows that I strongly believe that advocacy is part of what we do every day. I mean, when I go around and talk to people, we are patient advocates in the hospital. Now it's just taking that to another level and doing it on the state and federal level and how to do that. This is all about building relationships. We build those relationships of trust with our patients. You're doing the same thing with policymakers. You know, the difference is we're talking about a much larger group of people we're interacting with. I have had the pleasure to work with the college for a long time, and I joke saying they tolerate me to continue to do this. And I enjoy really the interactions that occur because you really talk to a lot of different people across the aisle. And the whole idea is bring consensus together on issues for our patients and our profession. And it really is building those relationships. It's not that one-time event. While it's nice to do it at the Leadership Summit, you really want to build upon these long-lasting relationships so that you can make calls and make communications when there are issues that are going on so your voice can be heard. I've had the benefit to do that across the country, and it really is useful when we have an issue coming up that we can have our voices really brought to the front of the line and really taken seriously because of the relationships and the time we spend working on those relationships.
So speaking of those relationships, the people who participated in the advocacy component of the Leadership and Advocacy Summit a short while ago met not like we used to in person in the Hill, but as we're doing today, by Zoom with their representatives or the staff for those representatives, contingent upon who it was. So what is the next step? What should we be doing? The meeting ended. Do we wait until next year? Do we send letters, or is there something else we can do in the interim?
So it's really, there's no set timeline. It's just about maintaining communication. So I'll take myself. After I participated in the Advocacy Summit, I met with a few of the congressional offices in Arizona, both senator offices, great people. I've met them before. Even though I've met them before, I sent them a thank you follow-up email just saying, hey, great seeing you, reminding them of the issues we talked about, and then I'll be in touch. And then also reminded them if they ever had any questions, here's my contact info, call me. Now, one thing that we have done recently, and I'm also involved with the Health Policy Advisory Council, or HPAC, if you will, we've got Surgeons' Voice, which we promote across the college. That's really a great way to engage, not just through the Action Center, but there's ability now for you to schedule a follow-up meeting with your legislature and do that based on your schedule. You mentioned doing it via Zoom. We're doing a lot of these now. The August recess is coming up because, as we know, Congress works very hard, so they need August off. But that's a time for them to be home, and you can interact with them. So you can set up a time for them when they're back in their district, in your area, to really sit and chat either via Zoom or even face-to-face to talk about issues and really follow up on what you talked about. We have another example of what happened the end of last year with the Medicare physician payment cuts, with the surprise billing information. That took a lot of effort of contacting numerous members of Congress to get that overturned or at least delayed, so we weren't seeing these large cuts across the board. And that's where the relationship building came in, because it wasn't a first time, hey, we're calling to talk to you. It's a, hey, you know me, we've talked about this, we've got a problem, can we figure out a solution? And they were more than willing to sit and talk to us about it because we have built those relationships. So this is an annual thing. I remind people, I would tell people to set it on your calendar that every once in a while you should just give the offices a call to say hello, talk about an issue, send an email. It's that kind of steady stream of reminding them that you're there. And before you know it, they're calling you to ask you for advice.
And indeed, the folks in Washington, D.C. call upon the college very frequently, thanks to you and the other folks, Christian and Frank and Patrick and everybody else who are busy working full time to help us out, to help us help our patients. But in order to help our patients, we've got to make sure there's access for our patients. And you mentioned we have a problem, and that was relative to last year. And here we are this year now, and we hear that we may again have a problem. So what should our course of action be?
Yeah, I guess you can say the good thing about advocacy is there's always something to do, right? It's more of a marathon than a sprint, and that when we have one issue we address, we move on to the next. And as you mentioned, our DC staff, and I can't begin to speak how great they are, and that we have the best DC staff that there is. That anything our accomplishments are is because of all the work they put in behind the scenes on our behalf, and I'm very thankful to work with them. When it comes to the new issue, yes, the Medicare physician payment, we did a great job of stopping it for a year, but it's only for a year. So of course, the end of the year is going to be approaching in several months, and we're back to this again where we need to talk about this issue. CMS just released its new recommendations for the 2022 cycle. There are some concerns. Obviously, as partly a result of us delaying the cut from last year, that's going to feed into next year. It's unfortunately one of those kicking the can down the road issues. So once again, we need all the members of our college to really, who can, engage with their members of Congress to talk about stopping these cuts again. I know it can be painful to do it every year. Right now, with the situation we're in, with everything else going on, with the pandemic still ongoing, this is kind of where Congress is, and you've got to work in the environment they're working in and really kind of open their eyes to our issues. So once again, we were really successful, probably our most successful campaign ever last year. Is we need everyone to kind of reach out via email and phone again and make those calls to remind their member of Congress to stop the cuts again.
So let's follow up on those two trains of thought. Firstly, letters. Now, you mentioned the Voice earlier in the advocacy office, and certainly Christian. Katie does a great job on the grassroots side and keeping us all informed. But somebody puts these letters together. I mean, you're not expecting fellows to draft their own freestyle narrative or type text. So are there letters there now that if people wanted to put in their zip code, their personal information, that the letters would populate? Because one of the wonderful things about the advocacy component has always been the ease of generating those letters to our elected representatives.
Absolutely. So surgeonsvoice.org really is plug and play. Our Surgeons Voice is now within the FACS.org website under advocacy. And that action toolkit is exactly what you talked about. You click on an issue, you put in your information, and it will automatically pull in your representative and your senators, whichever is the relevant party you're sending it to. And there is a pre-built letter that you can edit. So there's a form letter with the information. You can literally hit click and go and you're done. But if you want to make it more personal, and I always recommend if you want to do that, if you have a relationship with your member of Congress, it doesn't hurt. You can edit it, add what you want, and send it off that way. And that frequently changes. So that letter doesn't sit stagnant for a month. It could change depending on what comes out. I guarantee you with the information that we're getting the last couple of days, you're going to see an evolution of the letter. So you may have sent one 2 weeks ago. It won't be the same one you're going to send in a week. So you should almost bookmark it, put it as a favorite on Chrome or whichever, or Firefox, whatever you use. I'd say Internet Explorer, but that's gone away. So maybe Edge. And then really make sure you go and you check every few weeks, and all you do is hit click and send. The numbers matter. The number of times they hear about an issue, you want to remind them. I deal with residents, right? It's repetition with them. It's not one time and they get it. You've got to go over and over. It's the same thing with members of Congress. They're inundated with so much information. You want to keep on reminding them of our concerns and our issues. So you go on, you can click it every few weeks, send them a reminder message, and then also try to set up those meetings where you can talk to them face to face about it. You'd be surprised how far you get with these communications, because it shows that you're interested and engaged, and that actually has a significant impact on a member of Congress.
So that's great. And that brings up the second of the 2 points that I was going to touch upon based upon your comments. And that is, you mentioned email, you mentioned telephone communications. So let's say a surgeon is new to practice, or even a surgeon in training wants to get involved in the process, but wants to be sure that they're delivering the correct message. Because as you say, our legislators are overwhelmed, they're inundated with things, and they don't want to be talking about issue Z when we're interested in issue A. So how does one go about prepping for that first call or that first email?
Well, the first thing I remind everyone is that you talk to patients every day. you realize it's the same thing you're doing, just you're wearing suits instead of in an office and the patient's in a gown. So you don't need to get overly complex with it. You want to talk about how it's affecting you and affecting your patients. Again, on Surgeon's Voice, we have information as well as the advocacy pages on the website of what our concerns are and what our issues are. And there's some guides in there to help show you what we want to talk about and focus on. If you're also not sure, you can email anyone in the DC staff. You can email me. I'm happy to provide any information. It really isn't that difficult. It seems more daunting than it is. You think of a member of Congress and we see them a little differently. Again, we talk to patients every day. If you can have a complex conversation regarding surgical care with a patient, you'll be fine with a member of Congress or their staff. It really is talking about global issues and then how it personally affects you. They don't need to know every dollar or every regulation. That's not your job. Your job is to tell stories. Your job is to tell them about the 85-year-old cardiac patient who couldn't go to a sniff because she walked 50 feet in 1 inch. So the insurance company made her go home where she got a sternal infection. Those are the personal stories that you want to give that will weigh and give impact on what you want to tell the member of Congress. So you probably know a lot of this stuff already, but we have the information online and the staff available to help kind of put that together for you if you need that help.
That's tremendous information. Very, very useful. Just before we conclude, I'd like to give you the opportunity to share any other advice or requests which you may have for our listeners and viewers.
Well, I would always ask when you get a message from the college about this to please not just open it, but to do the action. We've tried really hard to make it as simple as possible. Numbers really matter here. The more of us that speak up, the greater impact we can have. We are not the only one who are bringing up our concerns, and not everyone agrees with us. Regardless, I know as surgeons, we think we're right, but there are other people on the other side of the aisle that have their opinions as well. If we're not there making our voices heard, we're going to get run over. Let's just brutally be blunt about it. That we have to be at the table, otherwise we're on the menu, as the saying goes. So we need to make sure that we're present. I know everyone's busy. I would challenge everyone, and I'm going to go back where I had the pleasure to work with Dr. Warshaw many years ago when I was on the PAC board. We put a book chapter together that talked about the 5-minute legislative consult, where basically you can take 5 minutes a week, call one of these representatives, state or federal, and just talk to the office and tell them that you're interested about things. They will keep track of that and put you down as an interested member of the district, and they will reach out to you when they have a question. You want to be an expert for them. We'll have them rely on you for information. So it's just like anything else. It's building the relationship. It's not that hard to do. It doesn't take that much time, but it really has a significant positive impact.
Well, thanks very much. We absolutely need to clone you, and your passion for what you do is very much appreciated. Without you and others like you, we wouldn't have had the result we did last year, and hopefully we'll be successful again this year in maintaining access for our patients. So thanks for your time today, and thanks for all you do every day for many years on behalf of the college.
Thanks so much. I really appreciate the opportunity to talk to everyone.